Mr. Mrs. America and all the ships at sea. This is Viewpoint, your program of personalities, qualifications, and perspectives. We'll start right away. Have a very important announcement. Very important. Pay attention, folks. The Donald will not be at Viewpoint next week.
Or any place else tomorrow night.
So we have an important personality and definitely some very important perspectives to discuss this morning. Kudos. Go ahead, Mrs. Busby. You told to ask for permission to have a kudo this morning.
I really would, because Bill and I have both been involved with a program through LSSI. That's Lutheran Social Services of Illinois. It's called Storybook at the prisons. Both prisons here and several around the state. And it's such a worthwhile program. You know, all the people who live here out south of town say...
in the dormitories.
In the dorms. Say, I'm never coming back here. Well, recidivism being what it is, sometimes they do come back. And I think that this business of their being able to pick out an age-appropriate book for their children, go to a room with a volunteer, visit on the recorder with the children, then read the book to the children, then visit another little minute, and then LSSI mails the CD of their visit with the children and the book to the kids at home. And it, I think, reinforces on and on that bond, because some of the people don't get to see their kids at all. And now that's one program that it looks like will go by the wayside. And LSSI has many worthwhile programs. But the money crunch isn't just something on paper. The money crunch is people.
It's real.
And I'd just like to say to LSSI, I'm awfully sorry to hear that they got caught just like everybody else, because that's a really good program that's probably going to go by the board at least for a while.
It's an interesting experience, Patrick, to sit and listen to. It always made it a point to get away from them so that they could read the book with some modicum of privacy, just the two of you in a room. And I always made it a point to go as far away from them as I can so they could have their space, so to speak. Sometimes it's very moving to hear these guys speak to their boys and girls. And Alonzo, I can't remember his name now, I shouldn't say it if I did anyway. He sang a book to his kid, and I sat up and took notice. It was really something. Anyway, thank you for mentioning that, Judith. Very, very important. Another quick kudo in the community. The Community Action Partnership. Once again, they're having a Jobs for Life program beginning in February. It's an 8-week course. It does a lot for folks who and there's a lot of this out here, who need some extra help and some skills in knowing how to go about, excuse me, please, applying for a job. And so kudos to Community Action Partnership for this. Now, Mrs. Busby, we have a lot to talk about this morning. Why don't you, while I run around and get the frog on my throat, I'll be back in a little bit. You introduce our guest.
I'm really happy to do that.
Again, we're
Patrick
very happy.
Doolin has integrity data uptown in the Scully building.
And he has
Thank you for saving that. And he has a program, a computer program that is being widely received, and it helps employers muddle through all the things about Obamacare, a program about which we talk all the time and know nothing about, actually. We plain people. I'm referring to myself, not Bill. But you've really had quite a following trying to figure this out. Now there were mandates for the taxes and for the first of the year. And how is that going with the employers who have your program?
Yeah, let's kind of catch up to where we left off before, Patrick. if we can kind of review what we were talking about, what was it, yesterday?
Yeah.
Go right ahead, Pat.
Well, thanks for having me again.
Well, we're appreciative of you being
Yeah, it has been a roller coaster out there for employers. The IRS, just to kind of a review briefly, the IRS has these reporting requirements for employers that mandate that they provide proof of their compliance with the Affordable Care Act. There are a lot of facets to the Affordable Care Act. This one in particular just being focused on the employer's responsibility. So if they have 50 full-time or full-time equivalent employees, they have to report to the IRS who they provided insurance for, how much that insurance cost the employee, and who was eligible for coverage, and did they offer coverage. So there are several components to this. It's very complex. They compile this information about what they've done for the employee throughout the year, and they report it on this year-end form that's called a 1095-C. Much like an employee receives a W-2 showing how many wages they've earned throughout the year, they receive a 1095-C if they were eligible for insurance coverage. So not
May I ask a question?
Not every employee gets one.
Eligibility. How does one determine whether an employee is eligible or not eligible?
There are a number of rules and calculations.
I'll bet there are.
A lot of it really boils down to their hours worked. So the IRS classifies an employee as full-time if they work 130 hours a month or more. There are a variety of ways to look at that calculation for part-time employees because they have variable hours. In essence, without getting into too much detail, if you look, the employers are required to look at the data about an employee from, say, October through December of 2015 to determine if that employee will be eligible for coverage throughout 2016. And the new employees that come on board during the year, they have, much like you're used to, kind of these waiting periods that they go through to determine whether they're eligible to receive coverage or not. But I won't go into the calculations. It's very complex. The rules are, although defined, it's what each employer has to determine what is the best rule or best way of following those rules for their business. So it's not a one-size-fits-all for every employer. For example, someone who doesn't have a lot of variable hour employees, they're all full-time employees, they can choose one method of calculating eligibility and determining who all will receive a 1095-C. For someone who has a lot of seasonal employees or a lot of turnover of part-time employees, quick serve markets, fast food chains, things like that, they can choose a different method. So part of what we do is we help explain to each of these employers what it is that they're facing and explain the options so that they can make a good business decision.
Well, your programs then have to be very, very varied, don't they? Because just one plan isn't going to cut it.
Yes. So a couple notes there. We have people that on our team that really digest all the details of the law continuously. They follow all the IRS
I do not know.
calls. They listen into everything. They read everything, and Ernie is what we call our director of ACA compliance, and this guy knows more about the law than anybody I've come across. including tax accountants and so-called professionals. And Ernie.
Good, you got Ernie.
Yeah, well, Ernie was a great addition to our team because he brought a level of depth into the law and understanding and interpretation of the law that you just can't gain by reading some of the publications from the IRS. Mm-hmm. My point in bringing that up is he sat down with our developers and said, okay, we have to look at every possible scenario of information that goes onto this form. And it ultimately, the form boils down to reporting a monthly summary of hours worked, offers of coverage, and if then there's a code associated that goes on this form for each month that employee works. And did they have coverage? Were they offered coverage? And so on. The combinations of criteria for decision making, he told me, was 677 different combinations for determining what the code should be to go in the box on that form for each month. Now, we have to cover all possible scenarios in our software. Employers don't necessarily have to consider all possibilities because they have, for example, if they're all full-time benefited employees, that's pretty straightforward for them. But from a software solution that we have to provide, it has to cover every possible scenario. And so our team has done a phenomenal job of taking all this information, digesting all of the details of the law, sometimes waiting on the IRS still to finalize some of the decisions, even at this late time, on what exactly the steps will be going forward. And an example of that is for those that have to file it electronically. They have to send it to the IRS electronically if they have more than 250 forms that they're turning in. Well, the rules are still a little bit fluid around how to get that information to the IRS electronically, even though we are running out of the calendar time for when they have to be turned in. So,
why do I think of Ronnie Reagan's comment? I'm from the government and I'm here to help you.
Yeah.
Really?
Do they give them any leeway since the rules that govern this aren't hard and fast yet?
Yes. So a couple things. For this first year, they give a number of pass cards, so to speak. So exemptions that said, okay, if you have a couple hundred employees and you get the information wrong, they'll give you 80 pass cards. So, for example, if you didn't offer coverage maybe and you were supposed to have offered coverage to that employee, but you didn't have the system down, okay, well, you could use that as one of your 80 to avoid a penalty. Mm-hmm. Or if what you offered wasn't affordable by their rules and you didn't realize it, then you could use that for one of the pass cards. The number of pass cards goes from 80 this year to 30 next year, and then
that's right back.
And then goes, continues to refine. They have also said for those employers that have between 50 and 100, well, it's actually 50 to 99 full-time employees, they will. The law actually has written in there that a reasonable effort to comply. So meaning they're not going to be hit as hard as those with 100 or more employees. They'll have a little bit more leniency. Now, what's the biggest change today versus when I was here last time is that the looming deadline for having these forms produced and in the hands of the employees was January 31st. Mm-hmm. And that was that aligns with the W-2 deadline. But the employers were not ready. And the IRS determined, based on the information, the types of questions they were getting, that people just were not ready. So they extended that deadline. And by extending that deadline, they also extended when the employer has to send the information into the IRS. So those deadlines are now March 31st. So they pushed it down 60 days, March 31st, to have those forms into the hands of your employees. It's May 31st to have the forms mailed into the IRS. And if you're sending them electronically, it's June 30th to have the data submitted to the IRS electronically. Some of that has to do with the fact that the IRS system for receiving some of this data, I don't believe is quite as ready as they'd like it to be as well. So
that happened with the Affordable Care Act as well. They need an Ernie.
They are, yeah, right. They are much more ready than what we saw when the government was standing up their new website and everything. But you combine their some of their misses where they're at, coupled with the fact that employers were just still unaware of what they had to do, and they decided, which I believe was a good decision, to move it down the road.
You know, she's so arrogant that I doubt if Nancy Pelosi had any cognizance at all of how stupid her statement was. We have to pass it so we know what's in it.
Because they don't know yet.
Because today they don't know. And I presume, Patrick, that a lot of firms all over this whole country have to hire people just to handle this phase of their bookkeeping.
You are correct, and I think
so. That adds jobs, but also adds overhead.
Unfortunately, the scenario plays out this way. Most of the responsibility for Affordable Care Act compliance for employers falls to their payroll and human resource departments. Those are non-revenue generating departments within any organization, so therefore they typically have very lean budgets to operate within. They don't typically have a lot of extra manpower.
Yeah.
And the resources are, at year end, they are working very hard to comply with the other mandates that they have around generating W-2s and getting the year-end close. So they were somewhat doubled up on effort, but didn't necessarily have double the resources, people resources, to do it. So this extension helps them spread it out a little bit.
Yeah.
Next year, the extensions, we're back to the original dates next year. So they have to figure it out this year to be more efficient with the next year.
So it's kind of like a rookie. Excuse me, Judy, go ahead.
You referenced last time you were here a company that had a really good insurance plan for their people, and then when it came to pass that all this compliance with the Affordable Care Act, et cetera, came into play, that they had to change their insurance plan and comply with what the government wanted, which was going to be less for the employees. Do you remember that?
Yep.
Now, what does the IRS know about that? Did you tell them?
That comes back to really what is the cost of coverage for both the employer and for the insurance company. So the insurance companies some have chosen not to offer the same coverage or the same plans that they were offering in certain geographic areas due to the costs and due to the compliance requirements. And that, unfortunately, is not good for the employee. If they've enjoyed the plan that they've had and they can go to their doctor, and either the insurance company chose not to offer that plan anymore, or the employer says we cannot afford that plan, to offer that plan to you because it's so expensive, then that requires the employee to choose a different plan, sometimes resulting in having to choose different doctors. So that's an unfortunate aspect of what is happening as a result. One of the things that I did mention previously was that one of the good aspects of this law is the pre-existing condition clause. So there are real life situations where people are suffering with illness and they cannot get insured, and it is a horrible place to be. They just they have nowhere to turn, and you can't afford to pay the price out of your pocket unless you're independently wealthy. If you have something like a car accident or a cancer or something. With that going away, everyone is is eligible to receive coverage. That is a very good thing about the law. The result, in some cases, geographically, the overall health rating for the general populace in an area may be, the health rating may be lower, which thereby drives the price of insurance up, because they calculate the cost of coverage based on the consensus data of a geographic area. So if you have a lot of sick people in one area, that will drive insurance prices up in that area for the same coverage that you might see in another area.
Yesterday on the news, they were talking about the price of insurance, and they said, well, if you can't afford all that, you can afford for catastrophic illness, and then let the rest go by the board. Now, what didn't I understand about what I know about that?
I'll give you a chance to ponder that, because we have costs here, and it's called operational cost, and we cover those by sponsors. So we'll acknowledge our sponsors right now, and then we're going to come back to Patrick Doolin. Right back live in the studios here. Viewpoint is your program. Our guest this morning is Mr. Patrick Doolin of Integrity Data Services, who does a real great job in our community and other things that are community related, and we want to just kind of not slip by that. That's very important. You folks do a great job in our community, Patrick. Over and above that, you're performing a great service, obviously for profit, because that's your profession. But there are a lot of people out there, scads of businesses out there, that wouldn't have a clue as to how to comply with the new Obamacare regulations. It's Judith K. asked a question that was so complex, I can't even begin to answer to ask you to go ahead on that. So,
well, I remember the question.
All right. Well, that's because you're a bright young fella.
Well, her question was the information that she's heard on the news about these plans that offer catastrophic coverage or major medical coverage, and how do those work, and are they good for employees? In essence, think of it this way: if you want to keep your individual costs down, you would purchase an insurance plan that would have a very high deductible and maybe have either no copay or a very high copay for office visits. Mm-hmm. Many of the plans that are available through the exchanges, now this varies state by state, but the plans that are available through the exchanges offer varying degrees of coverage, but this minimal essential coverage is the key factor. What is the bare minimum that you as an individual have to have, or that you as an employer have to offer in order to comply with the law? If you're in a financial struggle as an individual and the government says you have to have insurance, if you don't have it, you're breaking the law and you're going to be penalized by the IRS. Mm-hmm. Then if you're in a financial tight spot, you're going to want to find the bare minimum that you can to meet compliance, to say, yes, I comply with the law, and keep your out-of-pocket costs down. Those plans typically do not cover anything relative to doctor's visits, going to emergency rooms, prompt cares, prescription drugs, chiropractic care, things like that. They generally just cover these major medical or catastrophic events. You're diagnosed with a debilitating disease or cancer, or you're in a car accident or something like that, where your costs are going to immediately exceed this deductible. The important thing to keep in mind is you could be in a financial tight spot, have this coverage, get in a car accident. If your deductible is $5,000, you still have to come up with the $5,000.
That's a big piece of change.
If you're going to go to the emergency room,
that's $5,000.
Because you've got tightness in your chest, whatever that cost is, that will be your responsibility up to that deductible amount. So that's what those plans are. Their purpose really is to make sure that there is some coverage, and they're not all bad. We have heard that there are some states where those plans are very good for employees, and other states, our illustrious state of Illinois is one where they're not necessarily as great for the employee when it comes to the coverage for the cost.
As the Affordable Care Act was brought forth, there were more than a few employers who said, oh, what the hey, I'll just pay the penalty. I can't even figure that out. But that's not an option, is it?
No, not really. There are two components. One is, well, I'm not going to offer coverage, so penalize me if you want. That's the pay to play. And the penalty continues to go up as a de-incentivizer for the employers to do that. However, even if an employer says, I'm not going to provide coverage, just send me the penalty, they still are required to report the information to the IRS. That's the other component. They still have to do this year-end reporting of the 1095-Cs to the employees and 1094 to the IRS. If they don't do that, the penalties become astronomical. And if you're a large employer, they do the math and they can very quickly determine, well, it's easier just to comply and not pay the penalties because they're very, very large.
Now, with the changing of deadlines, when you're not going to have in hand these reports, how does the employee fill out his taxes that are, and that's probably going to have to be done and turned in?
That's a great question. That was one that we asked when the IRS announced that they were going to postpone the filing deadlines. What impact does this make to individuals filing their individual tax returns? The IRS has come out and said simply that you are not required to have this 1095-C or 1095-B in order to complete your tax return this year. That may change for next year because the information can be gathered from other places. And there's no way that we could see the IRS extending the individual filing deadline of April 15th. So therefore, they've made concessions to allow the individual to complete their tax return without having to have this form from the IRS. There are some conditions where if you're expecting a particular form, you need to wait, but that's not the general populace. If things need to be adjusted in any way, then they can file for an extension or amend the return later.
I think they should have named this act, however, / on the other hand, because there's an awful lot of that in play here.
Well, yes. Is it true? 648-5510. Somebody may have a question, Mr. Patrick Doolin, our guest this morning. Interestingly enough, this legislation, if you want to call it that, that has been passed, has created extra business for integrity data, and for that we thank them because that's probably the only decent thing that came out of it. This fellow Gruber, Jonathan Gruber, he supposedly was the author of all this. He couldn't have done all that by himself. He had to have a set of other nutcases with him. His primary role was the math behind calculating costs and how to cover those costs. And that was kind of his specialty on it, the financial end of it from the government's perspective. But no, there were very general components in the law that then the IRS has had to fill out and put kind of the details to it. What came out of Congress was not necessarily enough to be able to comply. You had to define it better in order to cover all the different scenarios. And it is unfortunate that it has grown so substantially in complexity. And so to the question, many ask us, well, what happens to this if we
elect a Republican president, and they're saying, well, the first thing we're going to do is repeal Obamacare.
Not so.
And the reality, that's a great soundbite for a politician.
Yeah.
But the reality is that there is so much intertwined with this that, and some parts of it are good. Not 100% of it is bad. When you take thousands and thousands and thousands of pages of the law, and you look across the entire United States, some people are being helped by this, and some, more and more people are having some level of insurance. So you can't just come in and strike out that item like it's a bullet point and say, no, we're going to do away with that. I don't see that happening. Someone may find a way, but the comments have been made. It'll be easier to repeal the law for our interstate highway system than it would be for the Affordable Care Act, because it's so intertwined and so complex.
Do you think there's a redundancy with it? For Illinois, we have Medicaid, rather, and also we have the child care mandate, so that all children are covered. And now we add this. Is it a redundancy or is it not?
Not really. So to put it in simplest terms, the law as it complies to our side of things with employers, the employer is only required to offer coverage to employees, not necessarily to their families and to their children. If you flip to the individual mandate, I as an individual am required to have insurance coverage for myself. My wife is required to have coverage for herself, and as their parents and guardians, it's our responsibility to have coverage for our children. So from the employer standpoint, the employer is not required to cover the children. As an individual, I am required to cover my children, and that's where then the options in Illinois are a little different than they are in some other states. When you look at Medicare, Medicaid, and how they apply to this, there really are just different funding mechanisms for the cost of services that are provided in their simplest form, which I struggle to say that because there's nothing simple about them. No. But that's what they're designed to do, is in essence supplement the costs.
But isn't there another spin-off to this whole picture, Patrick? It's an added cost to a lot of, some cases, a huge added cost to a lot of firms. Is it not fair to surmise that the prices on the street will be adjusted accordingly?
I believe we will see costs being adjusted as a result of healthcare costs, which the unfortunate side of that is the whole point of Affordable Care Act was to drive healthcare costs down. And it has done quite the opposite thus far. It's driven costs up substantially. And again, you can't say that across every geographic area. In some places, in some situations, costs have gone down a little bit, but predominantly, aggregate all the data together, the costs have gone up tremendously. Will it correct? Will it flatten and then begin to lower the costs? Not sure.
Not likely.
Anytime you're on the front end of something, starting it up, the costs are going to be higher. The time will tell, but the costs have jumped so high at this point in some areas that it's hard to see them coming back down to where they were. It's kind of like gas prices. Sometimes they jump for no real reason, and then they drop a little bit, and then they jump way back up again.
Yeah.
We're not seeing the coming down of costs yet, and I don't think we will until see any data that we can really analyze to bring those costs down until after this year is done, this filing year.
There are a lot of us anymore who don't have an employer. And I have...
Well, you have Jim.
Well, yeah, I didn't mean to forget you, Jim. I love you to death. I have really good insurance. I feel very lucky, thanks to my friend Carolyn. And it went up $3 a month, and I thought of myself as being the luckiest person in the known world. I am, aren't I?
You are. Yeah. There are some employer group plans and some individual plans that have stayed fairly flat. But those are more the exception than the rule. Typically, we hear in employers that their costs are going up double-digit percentages, so anything above 10%. Many are in the 20, 40, 50% range as their premium costs are going up. And when you have an employer that shares that cost with their employee, they are trying to provide maybe great insurance at a reasonable cost to the employee, to where maybe the employee pays nothing or pays up to 25% and the employer covers the rest. As those costs go up, the employers are having to adjust how much they're making their employees pay. And those things are also what are going to drive up consumer pricing of goods and services out there.
Well, none of us are ever going to be able to remember what the heck you said, Patrick.
Jim will. He's young.
Well,
Judy and I really appreciate your spending some time with us on that. One thing that we would like to get to before the clock runs away on us is creating entrepreneurial opportunities. That's near and dear to your heart. So let's address that for just a minute, Mr. Doolin.
Sure. Well, first I'll insert the shameless plug for anyone who wants to know any information about us or our company. It's integrity-data.com. Check us out.
Don't forget the dash in there, integrity-data.com.
That's correct. So the Land of Lincoln CEO program is something that we started this last year. It's been in the makings for several years. And CEO standing for Creating Entrepreneurial Opportunities. The real quick version of this is we take high school juniors and seniors. We work in conjunction with the classrooms, or with the schools. We pull the students out of the classroom and we put them in real life business situations. They don't meet at school, they meet at a business. They visit businesses, they talk to business owners, they have guest speakers come in and talk to them about real life business situations. These students start off learning how to handshake and look someone in the eye, introduce themselves, how to show up early instead of just at the time that they're supposed to be there, how to dress for success. And then they learn by experiencing real life business. And this, we have our inaugural class in going right now. They started in August of this year. We have 11 students that are from Lincoln, Mount Pulaski, and Olympia. They're in the program. Mm-hmm. And I believe you're going to have Jason Malhar, the class facilitator, here to talk sometime in the future. This is a phenomenal program geared to train and equip young entrepreneurs with real life experiences. The end result is for them to be able to understand what goes on in their community as far as the business world, see the opportunities, and be able to have something to come back to after school. So somewhat of stopping the brain drain. And it's not taking the brightest students. The process is not based on, of selection is not based on GPA. It's based on how they best fit criteria for being an entrepreneur. The class is holding a fundraising event for them. They are required to do two things in the second semester here. Start a real class business, real money, real profits, real losses. And as a class,
That'll get their attention.
Yes, they're learning hands-on, right? The other is they have to start their own business. So they have to write their business plans, they have to get funding, they have to talk to bankers, they have to talk to anybody about the suppliers and vendors and figure out customers and pricing. They have to do all of this as part of their class. It's a phenomenal learning experience. Again, real money. They are having a fundraising event that is their class business. that raises money for them to use for their individual businesses. And that is going to be on the 12th and 13th of February. And I am doing a promo here in an effort for the community to support these phenomenal, absolutely phenomenal students. These are our future leaders, and they are showing tremendous results. It's unbelievable. On the 12th, they're doing an interactive dinner, and the information can be found at WLCEO.com or on Facebook at WLCEO. And it's a trivia competition. They have silent auction.
It's okay.
And then lastly, they're doing a 5K run walk on Saturday morning, or Saturday around noon. A fun event. And I just ask that look into this, support the young entrepreneurs and the future business owners of our community, and this effort to help educate them on how to run a business. They have to show a profit out of this event, and they're raising money through sponsors.
So we're inviting the public to cooperate with them and endorse them and support them with this interactive dinner theater experience. That's going to be on the 12th. That should be an easy date for you, remember, Judith. Not bad, $30 for adults to go in there, and that's an investment, not an expense. You know,
yeah.
You can look at it that way.
I would encourage people to visit their website and their Facebook page to see pictures of what they're doing, hear the stories, hear the comments coming from these students. You think, this is a junior or senior in high school making this statement? I don't hear business people talking like this sometimes. So they are really, really impacted by this program. It is all a privately funded event. There are no tax dollars for this class or anything. All local businesses are covering the cost of the class. And many of the local businesses are paying again to support this project. So this is all privately done. It's not, there are no tax dollars, no city money, anything goes into this to make it happen. So it's the business community. On the
Abe walk run, as far as inclement weather is concerned, do we have a plan B?
There
like
is.
To the recreation center or something like that?
I offhand don't know what that plan B is, but I believe they posted it on their registration site, what the alternate date or...
Okay, our guest this morning has been Mr. Patrick Doolin. We appreciate very much you're a busy guy. Pretty obviously, those listeners that can hear what we've just been discussing this morning, your plate's pretty full. Notwithstanding, you are enthusiastically working behind the scenes for this creative entrepreneurial opportunities program, and we thank you very much for that. We're going to close with this quote about Obamacare. It has to do with our Congress, I think. If Obamacare is so wonderful, why is it the loudest advocates don't want to be subject to it? And with that, we'll thank Patrick Doolin for Integrity Data. Thank you for Viewpoint.
Thanks for having me.